Good morning, good morning, good morning, everyone. Oh, what a wonderful day. Today is day 12 of the Dr. Joanne Lewis Foundation Heart Disease Awareness Walk. So every day in February, we have been walking with you for 15 minutes, at least 15 minutes a day, to raise awareness of heart disease. And we take the time also to educate you a little bit about different risk factors for heart disease and how you can manage heart disease. So we had a very good educational conference on Tuesday. That's why we weren't physically walking with you on the video, but we had the conference, and some people really wanted to know more about the relationship between cholesterol and heart disease and the different types of lipids. So today we're going to dedicate just a few minutes to that. The video shouldn't be too long, but I would like to encourage you all to watch the other videos on our Facebook page or TikTok or YouTube, and to join our monthly wellness at the Dr. Joanne Lewis Foundation every Tuesday, at every second Tuesday of the month at 7 p.m. So let's talk a little bit about the types of lipids and their role in heart disease. First of all, we have to know what the different types of cholesterol are. So we have the LDL cholesterol, which everyone labels as the bad cholesterol, although we do need some level of the bad cholesterol too. The LDL carries cholesterol to the tissues. When levels are high, the LDL contributes to plaque buildup in the arteries, which is called atherosclerosis. This narrowing increases the risk of heart attack, stroke, and peripheral artery disease. And then we have the HDL, which is what's labeled as a good cholesterol. We want that level to be higher. So the HDL helps remove LDL from the bloodstream. Remember, the LDL is the bad cholesterol, the HDL is the good cholesterol. So the HDL helps remove the LDL from the bloodstream and carries it back to the liver for disposal. The higher HDL levels are associated with lower risk of heart disease. We also have triglycerides, the most common fat in the body used to carry energy. Used for energy. High triglycerides, especially when combined with high LDL or low HDL, raise the risk of heart attack and stroke. And we have the total cholesterol, which is a combined measure of LDL, HDL, and other lipid components. High total cholesterol often reflects elevated LDL and or triglycerides, both of which increase your risk of heart disease. So I mentioned atherosclerosis before. So that's when excess LDL and triglycerides deposit in the artery walls. Over time, plaque hardens and narrows in the arteries. And I remember our speaker mentioning that. This restricts blood flow and can lead to heart attack, which is blocked coronary arteries, stroke, which is blocked brain arteries, and peripheral artery disease, which is disease of the arteries in your extremities, lower legs. So these things can cause inflammation and vessel damage. Smoking, high blood pressure, high blood sugar worsen related lipid damage, okay? These factors accelerate plaque formation and instability. So there are general strategies that you can use. We don't give personalized medical advice on this platform, but consult your healthcare professional. But in general, we just like to give you some tidbits about how to promote your own wellness, but also check in with your healthcare provider, okay? So some patterns have been shown to improve cholesterol, which include the Mediterranean and DASH eating styles. So key principles of these diet styles are you choose unsaturated fats such as olive oil, nuts, fish. You limit your saturated fats, which are fatty meats or full fat dairy. So if you're gonna buy milk, make sure that it's low in fat. Remove the skin from your chicken, etc. Try to trim the fat off your meats. Avoid trans fats. Increase your fiber. Eat, a lot of whole grains, fruits, and vegetables. And reduce your sugar and refined carbs. You can substitute your regular sugar like with honey. So I encourage you all to walk with me at least 15 minutes a day. Increase that to 30 minutes a day, please. But we do encourage you to get about 150 minutes of exercise per week of moderate activity. That can help lower your LDL, which is your bad cholesterol, and your triglycerides. And it can help also to raise your good cholesterol, which is your HDL. Maintain a healthy weight. Even if you try to lose at least 5 or 10% of your body weight, if your BMI is high, like greater than 25, that can improve your cholesterol levels, okay? If you smoke, please quit smoking, because smoking lowers your good cholesterol, your HDL, and it increases your LDL. So smoking really is bad overall. And quitting improves artery function and reduces heart attack risk. Limit your alcohol, because excess alcohol raises triglycerides and blood pressure. Manage your stress. Wake up every day with a heart full of gratitude. Take some time to meditate and for prayer. Chronic stress can raise your bad cholesterol, which is your LDL, and lower your HDL, which is your good cholesterol. Get enough quality sleep. Normally recommend about 7 to 9 hours a night, because poor sleep is linked to higher cardiovascular risk. Monitor your numbers. Know what your cholesterol levels are, your lipid levels are. So adults typically need screening every 4 to 6 years. And if you have a lot of risk factors, then you may need more frequent screening, okay? Sometimes you may need some medical treatment. So if lifestyle changes aren't enough, they may recommend for you to get on medications to lower your LDL and triglycerides. So this is just a little tidbit about the relationship between lipids and heart disease. Every day I try to give you a little bit more information. I pray that you have a wonderful day on this day 12 of heart disease awareness. So see you tomorrow. Love ya.